Welcome all. Today I am going to take about the topic on mechanical ventilators in medical assist devices. Ventilators are life support devices that provide mechanical breathing assistance to patients who cannot breathe on their own. So these machines act as an intensive care medicine by maintaining respiratory function when natural breathing is compromised. So these are the mechanical ventilator setup which provide breathing assistance for patients with compromised respiratory function due to illness, injury or sedation during surgery. The primary function involves the exchange of gases which delivers oxygen to the bloodstream while removing carbon dioxide. So these mechanical ventilators are essential in emergency departments, operating rooms, and intensive care units. Ventilators also provide life sustaining support for patients with conditions like ARDS, pneumonia, and trauma. The key components of ventilators are control systems, which controls pressure or volume and also regulates the amount of air delivered and the pressure at which it's provided to prevent lung damage. Power sources that are necessary to drive the machine, and then gas delivery system which combines air and pure oxygen in precise ratios to achieve the desired oxygen concentration before delivering to the patient. Electronic displays showing real-time respiratory parameters and alarm systems are essential that alert for dangerous conditions. Ventilator inputs and their controls are FiO2, which provides the oxygen concentration which are adjustable from 21% to 100% pure oxygen, and then respiratory rate, which defines the number of breaths delivered per unit, and then PEP ratio, which is pressure maintained at the end of exhalation unit. The ventilation modes involved are assist mode, control mode, assist control mode, and SAMV mode. Ventilation modes determine how the machine interacts with the patient's breathing efforts. Control modes are used when patients cannot initiate breaths. Assisted modes support patient-triggered breaths. Support modes provide pressure assistance during inspiration but allow patients to control timing and rate. Modern ventilators offer dual modes that can switch between pressure and volume, which are targeted to optimize both lung protection and gas exchange. The choice of mode depends on the patient's condition, lung mechanics, and therapeutic goals. Patient ventilator interface involves the use of masks and nasal pillows for short-term use, and then nasal intubation for direct airway access. Surgical airway are used for long-term ventilation purpose. So these choices depend on patient conditions and then the duration of ventilation. So each option requires to provide intensive care to the patients. So the safety and alarm system involved in these mechanical ventilators provide immediate alerts for dangerous pressure levels, inadequate oxygen delivery, or abnormal carbon dioxide readings that could provide patient safety. These high priority alarms require immediate attention from healthcare providers. Battery backup systems, power failure alarms, and automated switchover mechanisms that maintain ventilation during power disruptions. So these redundant systems are essential for preventing ventilation gaps. Intelligent override functions that can automatically adjust ventilation parameters or switch modes when dangerous conditions are detected, which provides an additional layer of protection. The modern technologies involved in these ventilators have become increasingly compact and portable while maintaining advanced functionality. These modern ventilators allow for continued respiratory support during patient transport between facilities or departments and enable ventilation in resource limited settings. Artificial intelligence algorithms now help predict patient responses, suggest optimal settings, and automatically adjust the parameters based on changing patient conditions. The role that play modern ventilators in modern medicine have become fundamental tools in modern healthcare, particularly during the COVID 19 pandemic when respiratory support became a critical resource. So, this evaluation continue as researchers develop more lung protective strategies, patient friendly interfaces, and intelligent control systems. So, the technology advances, we can expect even more ventilators that better adapt to individual patient needs, reduce complications, and potentially enable more successful weaning. The ventilator waveforms that showed provide the pressure time waveform which displays the pressure changes over time during a breath. It is useful for monitoring peak inspiratory pressure and mean airway pressure. Flow time waveform shows the flow of gas into and out of the lungs over time. It helps in identifying the type of inspiratory flow pattern. Volume time waveform plots the volume of air delivered to the lungs over time. It is essential for monitoring tidal volume and ensuring consistent delivery. The safety and troubleshooting in mechanical ventilation involves effective communication among the healthcare team is essential to ensure safe ventilator management. Any changes in ventilator settings must be discussed and documented properly. Clinicians managing ventilators must demonstrate competency through regular evaluations. Ensure a functional bag valve mask is available at all times for manual ventilation during emergencies or in case of equipment failure. Ensuring safety in mechanical ventilation requires a multidisciplinary approach that combines proper training, effective communication. So, the mechanical ventilation is an essential tool in critical care medicine, providing support for patients with severe respiratory failure. Future efforts should focus on optimizing ventilator strategies to further enhance safety, comfort, and survival rates. Thanks for watching.